We start tonight with a special report illustrating the range of challenges faced by NHS staff in the struggle against coronavirus. Now, during the day, ministers have again promised that they're addressing the shortage of protective equipment, and the government's Deputy Chief Scientific Advisor said that the number of new infections across the UK was pretty much stable and flat. The Prime Minister has expressed caution about relaxing the lockdown too soon because he fears it could lead to a second peak. Now, the latest figures for the UK show there were 449 deaths reported in the last 24-hour period. That reflects a steady fall over the past few days. The official number of deaths in the UK linked to coronavirus is 16,509, but that number does not include deaths in care homes or in the community in England or in Northern Ireland. We start tonight with this extended report from inside the University Hospital in Wishaw, which is managed by NHS Lanarkshire, on the pressures of dealing with coronavirus patients from the very young to the elderly. The report is by our Special Correspondent Ed Thomas, producer Noel Titheradge and cameraman Huw Edwards.
She's been unwell for about a week now. She's a carer who works with COVID cases in the community.
Look beyond the daily statistics. These are the lives changed forever.
And that's you completely breathing on your own.
Listen, I'm a lucky one. I'm seeing my family tomorrow.
From those trying to save the sickest.
We've had 3 deaths, which has totally floored the staff today. It's probably the most amount of deaths in one shift that we've had so far.
To the eldest, most vulnerable. And the youngest.
The last thing you want to hear when you pick up the phone is your baby's got coronavirus.
Hospital life has been transformed.
Normally it's all full of parents all day, all night, so it's difficult.
Mums and dads of babies kept in for observation can only visit for an hour a day.
What was it like being away from your baby for 15 nights?
Couldn't sleep. It was so hard.
But these babies are never alone.
We said 4 p.m, isn't it?
4 p.m.
Receiving constant care.
What have the nurses and doctors been like here?
Honest to God, they've been a treat. They deserve a medal, every one of them.
To contain the virus, the maternity ward is now divided.
No one's allowed in.
It's to isolate coronavirus right there.
Yeah.
Peyton is 3 weeks old and has the virus.
I can't thank them enough for what they've done for her.
Are you waking up?
She's always watched over.
Definitely privileged to have such a great team behind her, cheering her on. She's been brilliant.
When you got your phone call saying your baby's got coronavirus, that's the worst thing I can only imagine. But you just need to power through and provide the best care we can give at this horrible time.
Tracy has now taken the decision to isolate with her baby.
Hi, baby.
Obviously, staff now are absolutely risking their life by looking after her, and let's not forget that. As cute and beautiful as she is, she's tested positive, so the staff that are handling her they are putting a risk.
Consultants now triage patients arriving at A&E.
What we're doing at the front door is then splitting patients. If they're possible COVID coming in one entrance, we can kind of split them from the start.
With separate paths throughout the hospital.
Suspected COVID-19?
Yes.
All are seen quickly.
She's been unwell for about a week now, you reckon?
Are you in pain just now, Lynn?
I just feel really sore, quite breathless and very, very, very tired.
Week after week, Lynn has been in and out of homes working as a carer.
On the COVID-19 team and home care.
Oh, right, okay.
I've been working really hard because to help
the vulnerable stay in their own homes
rather than because the hospital staff don't have the space for them. So I don't know whether we're really appreciated.
She's got a prescription.
In just weeks, the hospital's created 3 specialist wards for coronavirus patients.
Terrifying. And debt to the nurses and the doctors. I trusted them all. Without doubt. To work in an environment that they've never worked with before and to get the results they're getting is unbelievable.
And it's here, the ICU, where staff face the greatest uncertainties.
How intense has it been?
It's been overwhelming, to say the least. The staff have felt completely overwhelmed.
Some patients are spending up to 3 weeks here.
You are in fact their family because you're the only person that's here that's visiting them. So the staff are finding it really difficult. They're bereft when people are dying.
In the time we were here, there was no reprieve.
Unfortunately, we've had 3 deaths, which has totally floored the staff today.
In just weeks, this intensive care unit has quadrupled capacity.
You think we're getting to grips with this, and then you get another onslaught of admissions again. So every day you think, today will be a better day. The better day never ever comes.
The concern for Andrea is how long they can keep going.
So everybody's working more than their normal working hours. My main worry as the ward manager is that how long can staff sustain that? There's going to come a point where the staff are going to have burned themselves out.
But this is what sustains them. After 12 days in intensive care,
Amazing, isn't it?
Guy Heath is getting stronger.
Made me feel absolutely helpless. At times I didn't think I would make it.
Have you ever felt like this before, ever, with any illness?
Never, ever. I don't want to feel like this ever again.
What do you want to say to people?
Trust in our health service, because that's going to see us through this. The nurses, the doctors.
And every Thursday, our country echoes to the sound of thanks. Thanks to the physiotherapists working 12-hour nursing shifts in intensive care. The nurse living apart to protect her 3-year-old daughter.
That's you breathing completely on your own now.
So Kenny can finally breathe unaided.
I love them all. And thank you for all the support that they've given me since I've been in here.
And Guy can once again see his family.
The reality of dealing with coronavirus with all ages affected. That special report from Wishaw was by our special correspondent Ed Thomas.